This video isn't for fitness enthusiasts searching for new workout trends. This is for the men out there who are going through a difficult time, those facing challenges with their sexual health, particularly with erectile function. If that sounds like you, you're not alone. Today, I'm going to explain how specific exercises can significantly improve your erection quality, firmness, and overall sexual performance. I'm Dr. Fiona. I'm a board-certified urologist and andrologist, and on this channel, our focus is men's performance and health from a clinical and evidence-based perspective. If you're interested in improving your sexual function, stamina, or vitality, subscribe now and support this growing community. Now let's get right into the topic, because this may very well change the direction of your health and life. Erectile dysfunction isn't just a bedroom issue. Scientifically, it's often one of the earliest warning signs of vascular disease. You heard that right? Your inability to maintain an erection might be your body's way of signaling a deeper cardiovascular issue, such as endothelial dysfunction. Research has shown that erectile dysfunction shares several modifiable risk factors with leading cardiovascular diseases, including stroke and myocardial infarction. One of the most critical of these modifiable factors? Physical inactivity. Extensive studies and clinical meta-analyses affirm that regular physical exercise can improve erectile function through multiple physiological mechanisms. These include enhanced glucose metabolism, improved lipid profiles, blood pressure regulation, increased nitric oxide production, which is crucial for vasodilation, and hormonal balance, particularly with testosterone and cortisol modulation. Exercise also significantly enhances the effectiveness of medications like PDE5 inhibitors, including Tadalafil, widely prescribed for erectile difficulties. But before you rush to the nearest gym, let me give you 2 essential warnings that every man should take seriously before starting any training program. Firstly, many patients with erectile dysfunction may have hidden or undiagnosed cardiovascular disease. That's why a comprehensive cardiac evaluation with a specialist is not just recommended, it's essential. Your heart needs to be ready before your body can perform. Secondly, testosterone plays a key role in both sexual and physical performance. A low level of this vital hormone can severely dampen your results and motivation. So, before engaging in a full training protocol, get your blood work done. You may need testosterone optimization, which should only be done under strict medical supervision by a qualified andrologist or endocrinologist. Let's now explore 3 scientifically supported types of exercise that improve erectile strength and performance, with the last one being the most effective based on current research. First, do an activity that you already enjoy. It doesn't matter whether it's tennis, cycling, swimming, or brisk walking. This type of consistent aerobic or mixed training can enhance erectile function if practiced for at least 150 minutes per week at moderate to vigorous intensity. This could mean 30 minutes, 5 times a week, or 40 minutes across 4 days. The key metric here is intensity and consistency. Let me clarify what science defines as moderate versus vigorous physical activity. Moderate intensity will make you breathe faster, slightly short of breath, with a noticeable but manageable increase in heart rate. You can talk, but singing would be a struggle. On the other hand, vigorous activity brings you to the point where conversation becomes challenging, your breathing becomes rapid, and your heart is working intensely. If you're chatting too easily during your workout, you're likely not pushing hard enough. Consistency is more important than intensity. It's all about adherence. Enjoying the activity leads to commitment, and commitment is what drives results. If you're not currently active or don't enjoy traditional sports, don't worry. Your fitness plan can and should be tailored to your personal preferences and starting point, ideally under guidance from a qualified health professional or trainer. Studies show that both aerobic and anaerobic protocols, including resistance training, can be equally effective as long as the exercise is done regularly and at appropriate intensity. The second strategy, more targeted but often overlooked, involves pelvic floor muscle training, also known as PFMT. These are the muscles that support the pelvic organs and play key roles in the mechanisms of erection, ejaculation, and urinary and fecal continence. Surprisingly, most men do not isolate or train these muscles deliberately, which is a missed opportunity, both sexually and functionally. Though some pelvic floor activation occurs during lower body resistance exercises, isolating them requires proper technique and awareness. That's where the guidance of a specialized physiotherapist becomes essential. In structured programs designed to improve erectile dysfunction, a typical treatment cycle involves 5 to 20 supervised physiotherapy sessions over a period of 3 to 4 months. These sessions teach you how to properly activate, contract, and release the relevant muscles. Once you're proficient, the exercises continue daily at home, without supervision. Successful routines include both short, intense contractions lasting 1 second and longer, submaximal contractions sustained for up to 10 seconds. The clinical outcomes? Impressive. Studies report improvement rates between 35% and 47% in men with mild to moderate erectile dysfunction, without medication. That's a powerful result from a completely natural, body-driven intervention. Finally, we come to the gold standard, the most effective and scientifically validated method to combat erectile dysfunction: moderate to vigorous intensity, aerobic exercise. Meta-analyses in medical literature have confirmed that aerobic activities like running, cycling, or swimming performed consistently, again, for at least 150 to 160 minutes per week, yield the best improvements in erectile rigidity and function. These exercises stimulate nitric oxide production, improve endothelial health, and support better circulation to the penile arteries. And here's a key clinical insight. When combined with phosphodiesterase type 5 inhibitors, such as Tadalafil or Sildenafil, the outcome in many patients is significantly superior to exercise or medication alone. The synergy between physical conditioning and pharmacological support can transform your sexual health far more effectively than focusing on either in isolation. If you found value in these insights, don't keep them to yourself. Share this information with your trainer, your partner, or anyone else on the same journey. Sexual health is not a taboo. It's a vital part of your overall well-being and happiness. And remember, results require action. Physical transformation, hormonal balance, and erectile restoration are completely achievable. But they demand commitment to your body, your health, and your future. Take care, and I'll see you in the next video, where we'll be diving even deeper into ways to enhance peak male performance. Until then, stay strong, stay focused, and keep moving forward.